There we go. All right, I am here meeting with Karolina Schmid. She's a PMA board member and the founder and owner, is that correct, of Swiss Pilates and in Switzerland. And are you in Zurich? I'm sorry,
I'm in
Zurich. I'm saying
Zurich.
Zurich. You're in Zurich.
I'm in Zurich.
My mind immediately goes to another language. I'm like, Zurich? Okay. So great. So I will just jump right in. Thank you so much for speaking with me today. Tell me briefly about your background and what first interested you in Pilates.
Thank you, Jennifer. Yes. I'm a former university prof for sociology, health politics, health policy, I believe. And I was working in academia in Switzerland here. And at some point, I did some soul searching and reflecting and decided to go back to my initial love, which was Pilates. Gave up my job in academia to write programs and to open now the oldest chain of Pilates studios in Switzerland. And we're now active globally.
Oh, you're a chain of studios. I didn't even realize that. Oh,
Yeah.
very cool. And globally, so where are the studios?
We have PILATESwiss affiliated studios and partners in the Netherlands, in Canada, in Thailand, in Liechtenstein, Germany. So we're steadily growing. And as of last year, we also have started an online teacher education program.
Oh.
And so I'm making lemonade out of COVID. Yeah.
It sounds like it. That's awesome. And you
Trying,
said
yeah.
you were a sociology professor and you went back to your love in Pilates. So what was that? What got you initially interested in Pilates? Where did that begin?
So I did an undergraduate degree at the University of Toronto in women's studies back in the 80s. And I was working as a health consultant back in the 80s. When Pilates actually got its start in Toronto, I was doing something called health consulting. There was something called the Canadian Standardized Test of Fitness. Many of the viewers will not have been born in the 80s, but back in the 80s.
This viewer was.
Okay, so back in the 80s, we had something called the Canadian Standardized Test of Fitness, where you did a client's VO2 max caliper tests. And back in the 80s, just at the beginning of the 90s, there was a big boom in corporate health facilities. And I worked, some of my clients were Ford of Canada and Procter and Gamble and Kellogg's. And I was particularly involved and interested in corporate health programs. The beginning of the 90s, lots of studios, for example, in Toronto had either collaborations with fitness centers in Toronto or in different big cities, but a lot of them would also have member health, corporate wellness programs. They would have nap rooms and smoking cessation courses. And this was kind of the topic of a doctorate that I started to work on when I transferred to the University of Humboldt in Berlin, Germany in the 90s. So that's kind of been, academia and passion, Pilates passion at the same time. I was funding my university studies by teaching Pilates and being a health consultant.
Wow. Oh, that's amazing.
Thank you. Yeah.
Thank you for sharing that. So how you said you were a sociology professor, you studied health policy. Talk to me about how that's impacted the way you view Pilates.
Well, Jennifer, I think a lot of Pilates teachers and a lot of programs that have a reformer program or a rehab program based on Pilates are working with the assumption that Pilates is the same Pilates globally. So that if they go to Sydney or to Paris or to Melbourne, they're going to do the same Pilates. And even if it's a classical program with hundreds roll up, roll over, and the content of Joseph Pilates, your country's government, your country's health policy, your country's laws will have a huge impact on how Pilates is done. And as a domino effect, it will also have an impact on our well-being, right up to our health, and how we live, how happy we are, what our employers do for us, and how we consume Pilates or how we are funded in our country's health policy is completely different depending on where you're living.
Okay. Can you give me an example? Like
Yeah, sure.
how might the practice and the approach to Pilates, and even maybe it's in the public discussion of like the benefits of Pilates, how might that be different in, say, the Netherlands versus Switzerland, or
Yeah,
Liechtenstein versus
yeah. So,
Switzerland?
so first of all, last year, PILATESwiss became a PMA bronze member. So let me just back up here and tell the PMA members viewing this why it was important for me to become a PMA bronze member.
Yeah, I was going to ask you about that too. But go
It's
ahead,
really
share.
important because a lot of my affiliate studios and a lot of the international members who are representing PILATESwiss in other countries often think it has to do with having legal coverage. If you're associated, or if you do measures to associate yourself with accreditations or whatever, it helps you in terms of becoming liability covered or to get better insurance, or it has something to do with credibility and status as far as protecting ourselves. And that is really not the case. First of all, I cherish the PMA and the new strides it's doing. So me as a teacher and me as a company wanted to support the PMA becoming a bronze member. But what is not one of the motivating factors is that this helps us legally as far as our insurance or anything in that direction, which surprises a lot of our international Pilates colleagues. As a matter of fact, there has never, ever been a lawsuit of an incident happening in a fitness center or a Pilates studio in Switzerland, ever. So our environment is not motivated. Our movements in the Pilates studios and fitness industry is not motivated out of, well, I better get involved with this because it helps my insurance or my legal status or my credibility. I actually phoned a judge yesterday who actually is a Pilates teacher and an insurance broker, and I asked them both, why can I find no record of anything ever being sued in a fitness center or a Pilates studio? Because we don't do that here. So this is one big difference, that our motivation of how we insure ourselves, how we associate ourselves with different organization has got to do with love of the industry. Just like I know that in the PMA in the States right now, it's gotten a second wind and a new direction out of love of the professionality of Pilates and the Pilates industry. So when I associate myself with the PMA, it's not because I'm concerned about being sued. I want to further the industry, and it gets me revenue to be associated with the PMA. It gets me money, footfall to be associated as a business with the PMA. So any international studios and teachers, if you have that ITAT or PMA logo on your website, it's a seal of independent peers speaking about what you're doing. Just like I'm also associated with the Yoga Alliance for my teacher training program, just like I'm associated with the NCPT and the PMA, and all of these different programs are an independent group of peers that are blessing me and
they add to your credibility. Add to your credibility as
absolutely. So it's got nothing to do with insurance or fear of somebody checking my laundry basket. It's about, I want to support the industry and create support. And particularly in the Pilates industry, we have to be involved with the PMA because during lockdown, Pilates studios were considered non-essential. Hairdressers were open, cutting bangs, breathing into people's faces, but Pilates teachers and Pilates studios were considered non-essential in many European countries, probably in the States as well. And so it's really important as a teacher, as a teacher training company, globally to join the PMA and to be involved in the PMA. So that is long answer, but it's culturally completely different what motivates us, how we do it.
Okay, so, and when you say us, are you speaking specifically about Switzerland? Are you talking about Europe versus the US?
You know what,
Uh,
Jennifer? There are massive differences in the consummation of health promotion services in whatever different country. And this is right down to how we do Pilates, but how our government and our laws affect people's health and wellness activities. Let me give you an example. In Germany, our neighbor of Switzerland, for example, it is illegal to fluoridate the water in a community. So I would think, having lived in Canada, well, isn't that lovely? My community is interested in quality water, in providing this healthful fluoridation. You know, kids' teeth are rotting out of their heads with carbohydrates and sugar. And we know that bad teeth will affect the bloodstream, which will affect our health insurance status of our whole community. But you cannot, in certain countries in Europe, force anybody to do any measure health promoting because it's against their fundamental right to be unhealthy and have bad teeth. On the other hand, if you look at countries like the United States and Canada, we see companies that are doing corporate health programs where the average Canadian or American employer would say, nice, sweet, wow, you know, smoking cessation programs or fitness centers like I encountered and was working in when I was in Canada during my undergraduate university days. This is completely seen as Martian in Europe. I had the opportunity to go to Nike head office in Oregon about 20 years ago. And to say that my jaw dropped open is an understatement. I mean, they had a fitness center with a climbing wall and a big room full of reformers before we even had this boom of reformer studios. And they had weights and cardio and, you know, better than any premium club than you would ever see in many of the schwankiest countries. But the people who were working out at the Nike corporate center were doing so on their lunch, on their break, in their free time. And way above their heads, there was this big sign that said, not in our house. So it was frowned upon to wear any other brand than Nike. And you could say, well, is this attention to the collective economic well-being of the staff, or is this button into my business? Am I hired here to be a human resources person or a marketing person? And is it anybody's business if I smoke cigars on my free time? And so these are the big cultural differences in health and wellness that definitely affect how Pilates is done and how wellness is done. And
take me down to a teacher to student level.
Micro level?
Well, yeah, to a more micro level, and tell me how those differences.
So this is the bigger thing. So the bigger thing is that your corporate in your country's environment will have massive influence on health insurance. Some countries don't even have health insurance. There are people in countries who don't even have health insurance. And there's other countries where it's globally available. But for a Pilates teacher, for example, there are studios in Canada, I know, in the States, where you can get a chip at the reception, where you can put it on your mat class mat, where it says, I prefer not to have tactile cues. So that's one of the things I've always talked about. We have these big, huge difference between, can I touch you? Am I obliged to touch you? You know, consent, that is completely different from country to country. In some countries, you would have absolutely no touching. In other countries, you would see it as being a lousy class if they didn't come and tactile cue you. That's just the micro example. But the whole big picture is that countries will have cultural differences on how their Pilates studios are funded, how they're perceived, what status they have. We were non-essential here in Switzerland during lockdown. We were like, nightclubs. We were not considered essential. And the other thing is that how we talk about Pilates. For example, we're in the PILATESwiss Visceral method. Every single breath you release or you recruit the pelvic floor. And so I just had a graduate from the PILATESwiss program who's working in Texas, and she called me to say that she passed her NCPT exam. And I said, that's great. How's it going in Texas? Because in Texas, they have much different attitudes about speaking about the pelvic floor. So there are studies that say the best way for a man to recruit the pelvic floor is to cue the man to shorten the penis or squeeze the anus. Now, I am certain there are cultures out there who will not find that culturally acceptable to use that verbiage.
Yeah.
But that is a good example of how we do it completely differently. Yeah.
That's a good example.
Yeah, there's studies on that. There's absolute studies on that.
Really? And so how do you teach? You teach using the breath to recruit the
Yeah, well, we have a completely different breath, as I understand. Our recruitment of the local muscles are something called a staggered breath, and every movement has a release and a contraction. So that's different than saying brace your core and don't forget to breathe. It's associated with every movement having a pelvic floor cue or release. And that is specifically Swiss. That is something we do over here. For example, we often will have whole chains of studios who don't do pregnancy Pilates because we do it the breath so differently. But in other countries, there's pregnancy Pilates as a proactive, healthy thing. And that's based with a different concept, which all has its merits. Yeah. So how you do Pilates is completely different.
And I guess, the lesson for folks who are teaching Pilates across cultures, wherever you might be, would you say that it's important to, how do you ensure as a Pilates teacher that you are adapting or able to adapt to those differences? If you have folks if you're in a country where you've got people who have learned Pilates in their country and they're now with you, how do you adapt, or how do you know to adapt? Am I asking that question properly?
Yeah, I think I get what you're saying, Jennifer. So we often get folks into Zurich, into our studios in Zurich, and they say, yeah, I've done my Pilates in Dubai or in Paris or whatever. And I say, oh, great, you're familiar. Okay, let's start with the breath. And they go, breath? And I say, you go get your money back, because the most important thing in Pilates is the breath. Yeah. And so I don't think it's enough to pretend like it doesn't exist, like there's a dead body in front of us and we're ignoring it. Every single lesson, every single client, we have to recommunicate how this studio or how this method is working. And you can think of it this way. Yoga is different as night and day. You'll have restorative yoga where people are drooling with their glasses crooked on the mat, but then you'll have really athletic Ashtanga type yoga. And so just like that, Pilates is completely different based on who's teaching it and which culture and which law and environment it's in. And just one more thing on that, you also will have a huge impact on how your Pilates is received depending on where you are. So there's a guy in Berlin called Rolf Rosenbrock, and he runs something called das Wissenschaftliches Institut. It's an institute of science. And he did a study in the 90s, which tested people's ability to convey their happiness. And so if you're living in Denmark or the Netherlands, I don't know if you were happier, but you're more able to convey happiness. And that in domino effect will have an immense effect on a person's well-being and their health and the load on the health costs of a country. And then as you go more southerly in Europe, you get people who are more able to express their unhappiness. So it's not like all of a sudden Spain and Italy are curmudgeons or Greek people are unhappy, but they're more able to express their unhappiness.
They're more expressive.
Yeah. And so happiness is very cultural. And there's whole states in the United States where folks smile more. How wonderful to go on holidays where people are all just really happy. I mean, that
Yeah.
will affect your environment, that will affect your health, and your environment will affect your attitudes to your body, your employer, the government, your laws will affect how long you live.
Yeah.
So this is
I
why I,
love how you made those connections, because I think it's so important to realize that even down to the foods we eat impact the way that we feel, which impact the way that we engage and interact with others, which impacts the way that communities connect with one another, states, countries, nations, the world, right? So I love that you've made that connection. You have actually answered all the questions I was going to ask you. I was going to ask you if you're teaching people from other countries, how you adapt to cultural differences. You talked about that. About 20% of PMA members are outside the US. That's a significant number. So I think we need to have more conversations like this to understand I think it's very interesting to understand the nuances of Pilates in those different countries. Is there anything else that you'd like to add that I haven't asked you that
yes,
you'd like to focus on?
yes, Jennifer, thank you for saying that. Those 20% at least should save the date of April 14th, because my job on the Pilates PMA board of directors in the membership committee is also involved with the international members. And we're going to be having a meeting for you international members out there. So even if you're not an international members, get on this, because we as a community, we as the PMA and my colleagues at the PMA board of directors have been working so hard with the different committees and boards. But on April 14th, there will be a specific meeting over the PMA website, which I'm hosting for international members. So we want to hear international voices. People are not aware enough of what's going on with our Pilates community in different countries. And those 20% of PMA members, please save the date. Please tell your member colleagues, even if you're not internationally working as a Pilates teacher, April 14th, we're going to have a big meeting, and I'm going to be bringing up different conversations relevant to our international teacher colleagues, but also to the folks based in the States and countries in North America.
That's excellent. So that is Thursday, April 14th. What time and how do they get access to the meeting? Is it a Zoom meeting? How does that take? Will there be?
Yeah, it's I don't know. I'm hesitant to say what time, because we have it all scheduled with different time zones.
Okay,
But it,
we'll save the date then, and we'll provide
save
all
the
the
date.
details. We'll provide details, I'm sure, in our email. We have a weekly
Yeah.
newsletter,
Yeah.
and so we'll provide the details there if you don't have them now.
Yeah. And just go on the PMA website, because the list of upcoming events and connects and educates, aside from the meeting on April 14th, is amazing. And it's really important for us as a community to go there, to rev up and gas up our batteries as teachers after all of this craziness.
Yeah, those events are targeted directly to help you improve your business, to keep you developed professionally and educate you and to connect you with
Yep.
Pilates professionals from around the world. Thank you so much for your time. This has been great.
Thank you very much for the talk, Jennifer.